Listening Part A. You hear a doctor talking to a new patient called Mrs. Black. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Black, isn't it?
Yes.
I believe it's your first time to this clinic?
Yes, we've just moved to the area, so we're looking for a new GP.
Right. Well, how can I help you today?
Oh, well, I'm actually a bit worried about our daughter Mia. She's 15 now and she's always been very healthy, but recently she's gotten very thin and I'm worried that it might be anorexia.
Okay, I see. Can you tell me a little bit more about Mia?
Well, she always used to eat with the family, but lately she says she hasn't got time to eat with us because she's too busy. So she takes a plate into her room and eats in there. She skips breakfast a lot as well, or just has a glass of juice, a couple of bites of toast before she goes out the door and off to school.
Mm-hmm.
It all started late last year, but I'm really not sure what triggered the change.
And what about school? How's she going?
Oh, she's a good student. She gets high marks in most exams. Her teachers have always said she's a quiet girl, but she works really hard. Now that I think of it, her maths teacher told us at a recent parent-teacher interview that lately she seems to be having trouble concentrating in class. He said that she was never like that before, and he wondered if we could think of any reason why it might be happening now.
I see.
She doesn't have many friends, just one or two girls she's close with. She's always been a bit shy and reserved. She doesn't have a boyfriend, and we wouldn't allow it at her age anyway. After school she does ballet, which she loves, but apart from that she tends to spend a lot of time lying around the house, usually in her room.
And what about her weight? You said she'd become quite thin?
Yeah, she really has. I've tried talking to her about it, but of course she won't tell me how much. Her clothes don't seem to fit her properly anymore, though. They just hang off her like sacks. She seems obsessed about her appearance lately, too. I always catch her standing in front of the mirror. I don't think she's sleeping very well either. She stays up very late at night, reading or playing around on her phone. And then, of course, she'll be tired and moody in the morning.
Anything else you can tell me about Mia?
Oh, yeah, she seems to have been getting a lot of headaches lately. I can't remember her really having them before, and I found a box of laxatives in her room. I even think she's been throwing up, but she denies it, of course. So that's a big concern for her father and me too. So what do you think, Doctor? From what I've told you, do you think Mia has anorexia?
Well, without meeting Mia and assessing her, which I think I'll need to do, it's hard to make that judgment. However, I can give you some information about anorexia, and then I think we need to arrange for me to see your daughter sooner rather than later.
Okay, I understand. Anything you can tell me, any advice you might have would be very helpful. We've tried talking to her to see if she's all right, but she's very sensitive about it all. The moment we mention anything, she gets very upset.
I do understand it's difficult, but the good news is there are options available. If we think it's necessary, we may even have to consider referral to a psychiatrist. Listening Part A practice. In this task, you'll hear a physiotherapist talking to a patient called Ryan Henderson. Answer the questions below by completing the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Ryan Henderson? Please come in and take a seat. My name's Kathy. I understand from your GP that you've got a problem with your knee.
Oh, hi there. Yeah, that's right. It's just the left knee, just below the kneecap. It started about 4 weeks ago. I first noticed it when I'd go for a run. I'd get this sort of niggling pain, which would get increasingly worse. It's gotten to the point where sometimes I even have to cut my run short.
Does anything else seem to aggravate it?
Yeah, actually, going from when I'm sitting and then standing, or when I'm sitting at a desk with my knee bent, I really feel the pain then. It's not very sore at the moment, but it seems to be getting worse as the day goes on. It doesn't wake me up when I'm sleeping or anything like that, but it seems to go away during the night, and I suppose that's why it feels better in the mornings.
Okay. Do you have any other symptoms like pins and needles or numbness in your knee?
No, nothing like that.
Do you have any history of injuries or accidents that might account for the pain?
Well, I cut my left knee pretty badly climbing over a concrete wall when I was younger, but that was about 15 years ago or more, so I don't think that would have anything to do with this. It gave me a pretty crazy scar though.
Ah, I see.
Other than that, I've just had your typical sorts of injuries. I broke the little toe in my left foot playing football when I was about 10. Ever since then, I've had to wear shoes a size larger. Then, when I was about 25, I twisted my right ankle playing squash and ended up breaking a small bone and just here, what's it called? Is it the fibula?
Ah, yes, that's right.
Okay, but it's been fine. Haven't had any problems with it since. Then just last year, I broke the little finger on my right hand playing rugby. Totally unexpected that was. And I almost forgot I've had this bursitis in my left hip.
And when was that?
Last year, I saw one of your colleagues actually for some physio treatment, and they said to take a break from running for 6 months, which I did. I did a lot of stretching and I started doing yoga twice a week. It seemed to help, so I was able to start running again after Christmas.
And is the bursitis better now?
Yep, there's no pain in the hip. Now it's the darn knee that's giving me grief.
Yeah, well, can I just get you to stand for me and put your full weight on your left leg?
Yeah, sure.
Tell me, how does that feel? Any pain or discomfort?
Yeah, I can feel it is a bit niggly just at the front of the kneecap, and I do feel a bit of pain.
And if you do like a little half squat, bend your knees and come back up. What's that like?
Oh, ow. I can feel a bit of pain in both knees actually. More in my left knee, like a sharp pain, but there's definitely a little ache in that right knee now as well. I'll just try standing on my left leg again and see what that's like. Oh, that really hurts.
A lot worse?
Definitely.
Okay. Can you sit on the side of the bed and I'm just going to test the muscle strength. I want you to push your right leg out against me as hard as you can go. Is that okay?
Yeah, okay. It's harder to do with my left leg though. Like it's weaker or something. Like I can't get enough power through it. That's really strange. I hadn't realised it was that weak before.
Well, Ryan, I think I know what's going on with your knee. It appears that your kneecap is a little bit out of alignment.
Oh, wow, okay. And how does that happen?
It can occur because the ligament, which we call the iliotibial band, it's gotten a bit too tight on the outside of your thigh. And in your case, I can see that there is some minor swelling on the outside of your left knee, which means there's some underlying inflammation there.
I guess that explains the pain then. Seems like my days of pounding the pavement might be over. I might have to find some other way of getting my exercise. That's really disappointing. I've been into running since I was in secondary school. Used to be on the cross-country team and everything. But now it seems like every time I lace up, I get problems.
That is the end of listening part A.